Johnson. I'm here from Spectrum Health, Gerber Memorial, in beautiful Newaygo County, Michigan. From you can see from the lake behind me, we have a lot of beautiful inland lakes, trees, gorgeous open areas. We're a rural community of about 50,000 individuals. We're really a community of contradictions. So we live here in this beauty, and we have all these farmers markets and fruit farms and vegetables, and yet we have a lot of our citizens who are not getting adequate consumption of fruit and vegetables on a daily basis. We have a great nonprofit sector with a lot of well-meaning people looking to do great work, but that same sector is very fragmented. We have a lot of income inequality because this is the home of Gerber baby food. We have a lot of wealth at the high end of the spectrum. We also have a lot of poverty, especially generational poverty that you can imagine in a rural community. Some of the risks and conditions that make it hard to move towards a culture of health are some of those exact same things. So a very segmented nonprofit sector, not a lack of a common definition of what health really means and what that can look like and why that's important for everyone in the community. People still think of health as traditional health care. We're really trying to expand that definition into well-being. As far as risks, we have a high rate of teenage pregnancy. We have a high rate of poverty. We have a high rate of obesity and smoking, especially among pregnant women. We have low educational attainment, specifically low high school graduation rates and low college, having some college at least. We also have a lack of primary care access as far as not having enough primary care physicians for our population. So as far as what we would do if we won this Culture of Health Award, I am the chair of the Love Well Newaygo County Healthcare Coalition. In the last 2 years, I've really worked on moving that group from coming together and just talking about what everyone's doing every month to really being much more of a collective impact model. So we have a common agenda, we have operating guidelines, we changed our name, we have a marketing plan, we have a vision, we have a strategic plan of where we're going to go in the next 3 years and what that looks like. So I'd love to be able to use the tools and resources from Robert Wood Johnson's Culture of Health to be able to really get us to that next step, to leverage all the assets that we have in our community. We have great access to fruits and vegetables. We have a great healthcare system. We have partners who have really built the relationship over the last year with primary care, home health, a hospital, a wellness center, rehab, health and human services, Newaygo County Mental Health, our FQHC, and our health district. So we have the right people, we have the right tools and places. We just need you to help us get to that next step.